gland, but there are many minor salivary glands. The salivary gland tumors can be of two types, benign and malignant. Most salivary gland tumors are benign. There are many types like okay. Okay.
That's a very good job done at this institute. So this case is open for discussion.
First study has no biopsy.
First time we didn't have any biopsy.
The note was cervical
First
operation.
Sir.
First operation, note was cervical operation. First study.
What was the operation done and it was
First operative note was there.
Cervical operation.
Yeah, superficial parotidectomy was done at that time, but biopsy was not taken.
You see, this seems to be a very unfavorable histological type and aggressive behavior, biological behavior. Initial surgery was inadequate. Second surgery was also inadequate. You should have done a open section before undertaking second surgery. That would have shown whether it is benign or committed one. We could have prevented from the third surgery if you have done a open section at the time of second surgery.
Yes.
So whatever has been done, you have done a good job, but in view of the very aggressive biological behavior, it is an plastic type of growth. And I think you should think of giving him some adjuvant chemotherapy also, besides adjuvant.
Sir, actually, chemotherapy has no review.
Chemotherapy has got no role, it not right. Any anaplastic tumor, very undifferentiated tumor, with aggressive behavior, and it is a well-differentiated tumor, we should have said it will follow up. But it is such young, with such aggressive behavior, it is likely to show up pulmonary metastasis very soon. So it will be better to exhibit it.
Muco-Epidermoid is more likely to have local recurrence than distant. Muco-Epidermoid tumors are not usually having a distant blood space. Therapy would have typically a reasonable
This was a very poor child, actually not a liver patient. He was a very poor child who had come from Darbhanga, I think, in Bihar. And he had already undergone, I presume it must not have been a classical superficial parotidectomy, but some kind of surgery had been done and he had come with a recurrence, possibly residual tumor or whatever. And the biopsy had not been done for whatever reason. Now that obviously is not correct when you remove a specimen from biopsy, but it was not done. So we have no control over that. And he had already come with an FNAC showing pleomorphic adenoma. So on that basis, the superficial parotidectomy was done. But when he came back with then he was lost to follow-up for 2 months. He came back with a recurrence, and we realized it was fixed to the bone, and there was only one chance for this young boy. In fact, normally these tumors would occur in about, say, 35, 40 years, 50 years of age, but he was just a 10, 12-year-old boy. And we realized that this was his last opportunity. He was very poor, he couldn't afford anything. So we had to do a real wide excision. We did it with the nerve. First time we preserved it, but second time we removed the nerve, mandible, the zygoma, as well as the pterygoid process of the sphenoid in order to get clear margins. Obviously, as you very rightly said, that this does carry a poor prognosis, but with a 10% kind of long-term survival. But we've done a wide clearance, we are giving him adjuvant radiation, and as Dr. Saha said, most of the time the problems happen with the loco-regional recurrences. But let us see how he behaves, we are not sure, but we have tried to do whatever we could under the circumstances, because the skin was also gone, so then I helped us with the free radial forearm flap, which was done to reconstruct the skin for the young boy. No, because that was such a huge tumor that, you know, the amount of facial nerve that had gone, it would not have really worked with the facial nerve.
What about this high?
And that too, you know, we would be radiating this patient immediately after that. So, because that was much more important with this kind of high-grade tumor, to get in both the therapies is more important than rather than trying to preserve a facial nerve which is not going to
Eye care, so what is the about the care of the eye?
Yes, we did a tarsorrhaphy at the same sitting. We did a tarsorrhaphy.
Okay, thank you everybody. So we go to the next place. The phase of